Hi, this is Dr. Amala, consultant rheumatologist at Arca Hospitals, Kurnool. Today, on the eve of World Arthritis Day, I am going to discuss regarding invisible illness and the challenges of being looking well on the outer side but feeling terrible on the inside. Basically, I would like to discuss there is a dissociation between how you feel and how you look like on the outer side in all the autoimmune diseases. Firstly, I would like to take an example of a middle-aged female who had roamed around for almost 5-6 years with complaints of fatigue, pains all over, and recent onset dryness of mouth and dryness of eyes. She has seen a lot of consultants and she has explained her own symptoms, but because there was no subjective evidence of her symptoms, she was ignored all the time, saying everything is in your head. But once we evaluated, we have found out to be her inflammatory parameters are normal, but her ANA profile has shown Sjogren's syndrome. So after treating, she is feeling completely good as of now. So basically, so many housewives, they have lot of symptoms on the inner side, but they somehow manage to complete their daily activities but not able to express their illness because they are not significant enough and they are not seen by anybody else than themselves. So most of the housewives who are experiencing those symptoms actually will be suffering from one or the other chronic diseases like chronic fatigue syndromes, fibromyalgia, or even most of the autoimmune diseases like arthritis, lupus, or Sjogren's syndromes, which will come into light when they have significant involvement like weakness of muscles, deformities, or when they have burnt out diseases. So I would like to, first thing is they can't prove their illness because it is most of the times the subjective symptoms like pain and functional limitations. Second thing is most of the times they will have fluctuating illness, means theory called good day trap, that is one day they will use all their resources and effort and energy to have a good day and that influence will be on the next day. So there will be fluctuating illness and people see them as how can a person with illness can be fine on one day and not feeling good on the other day. And because of this, even though they are having illness, they will have sense of guilt that they don't have illness but they are not able to do their daily activities, and so they refuse to seek help from either doctors or their family members. So what can be done to surface these problems is, first, from the patient's point of view, they have to set boundaries. They should start saying no, and if they are not feeling well, they should explain their concerns to the family members and also to the doctor so that they can get some help. Second thing is from the patient attenders or patient loved ones point of view. Believe in what they are saying and you tell them, I believe you that you are not feeling well, and be specific and ask them how can you help them. And from the doctor's point of view, even if you are in a busy clinic and you feel all the reports are normal and patient is suffering, then listen to them, diagnose if something is there out of the way other than investigations, and try to help them by putting them into some support groups or online communities so that they can feel more comfortable sharing with the alike-minded people and same disease. The conclusion being, the struggle of these invisible illnesses is actually much profound and real. So main thing is we have to inculcate a culture of where we can show profound compassion freely without judging the patient or to wait for the subjective. Only you shouldn't ignore them because there is no subjective evidence.